Now, 16 staff of the Komfo Anokye Teaching Hospital have been sanctioned for various breaches of the hospital's disciplinary codes, including extortion and medical negligence. So, while one staff has been dismissed, the remaining have been suspended without salaries as management probes others to instill discipline at the hospital. The move is an effort and commitment to improve healthcare delivery in the Ashanti region and beyond. Emmanuel Bright-Kweku was at the media review meeting of the hospital and reports.
At its 2023 theme, driving a customer-centric agenda for healthcare delivery, the role of management, staff and stakeholders, the management of CATH implemented practical measures to improve patients' experience at the hospital. The hospital conducted a combination of interventions, including improved staff output and enforcement of discipline, which saw the dismissal of some staff. The hospital says the sanctions have resulted in better healthcare delivery to patients during the period under review. Chief Executive of CATH, Professor Ochre Ade-Mensah, was speaking at the hospital's media review meeting.
One thing we have not toyed with is discipline in the hospital. And like I indicated, about 16 staff have been sanctioned. There's a dismissal, some have been suspended for months without salaries, some have been cautioned, various offenses. Any of them, sometimes extortion has come up a couple of times, and many others. Negligence of duty, I can't remember off the top of my head, but I think that there are a couple of cases like that that are being investigated. Ultimately, when the investigations are done, and you heard me say that the Quality Assurance Unit has been strengthened. The Quality Assurance Unit is largely responsible for many of these things. And so when issues like this are reported to management of the Quality Assurance Unit, committees are set up and then recommendations are made.
According to management, the hospital's infrastructures have received major facelifts in recent months as they work to complete other stalled and ongoing projects.
They are looking at renovating the main theatre. It has never seen any renovation since it was again built. But as we speak, the renovation of the main theatre is going on, and so we have had to, construct makeshift theatres to take care of the cases as and when they come. Maternity block. Yes, I am aware that the exigencies of the time had an effect on completion of that block. The truth, however, is that discussions have been had, and I'm told that as soon as practicable, would have people move to site and have it completed. Once it is done, the whole of the A block would move to that block. Parts of B and C will also move, create some more space in the old block, which old block is going to see some renovation.
A study conducted on vehicular congestion at the hospital revealed 64% of cars use the hospital's prisons as thoroughfare. Management says measures have been instituted to curtail the situation which impedes transportation of critically ill patients into the hospital.
There have been instances in the past where individuals who required emergency attention were caught in traffic in the hospital. I don't think that this should be happening in 21st century Ghana. And so what we are trying to do is to ensure that when our patients get in here, they would have easy access to the emergency areas to be seen.
Meanwhile, management is expecting to complete the first phase of renovation works of the old inpatient facilities of the hospital as the Asante-Hene leads charge to raise $10,000 for the project. For Joy News, my name is Emmanuel Bright-Kweku.